Hi everyone, my name is Alyssa Brogier and I am a member of the Houston Cone Urge chapter here in Texas. You might know me from my other podcast, Spaghetti Fiction Podcast, where we talk about movies and all that fun stuff. And we are going to be talking about hashtag Free the Pill Fest. We love that. We love talking about repro justice in this house. I was last year, up until actually May, I was in the Temusisi student chapter, also called Islander Feminist. Shout out to my homies back in Corpus. Love them. They are so great. As some of you are probably wondering, what is URGE? Well, so you're probably wondering, what is URGE? Well, URGE stands for Unite for Reproductive Justice and Equity. And from their website, they say their mission is they envision a liberated world where we can live with justice, love freely, express our gender and sexuality, and define and create families of our choosing. And we love that. What is reproductive justice? Well, it is defined as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. And it's not just necessarily about reproductive rights. We have a lot of things that fall under the umbrella of repro justice that URGE in particular is working for. And some of these things include equal access to safe abortion, affordable contraceptives, freedom from sexual violence, equity for everyone from diverse socioeconomic backgrounds. And there are many, many more things that fall under that umbrella. I'm sure you can go look those up. And so let's talk about some of the things that we're working toward. And yeah, that's just a little bit delving into repro justice and URGE. I'm going to leave and so the main reason we are here today is to talk about hashtag Free the Pill. Now, what is Free the Pill, you ask? It is a campaign to educate and engage the public and support over-the-counter birth control options in the U.S. Free the Pill Fest is happening October 13th through 14th, hosted by URGE. It is a campaign to educate and engage the public in support of over-the-counter birth control options in the U.S., something that definitely needs to happen. From some of the research I did, the hashtag Free the Pill was founded by IBIS Reproductive Health. And so taken from their website, it says, we, IBIS, are calling attention to the barriers too many people still face in accessing the birth control pill and demonstrating the widespread support for bringing the pill over the counter in the United States. People know what's best for themselves, their bodies, their future. Everyone should have full control over their sexual and reproductive lives, and birth control is critical to making that happen. With that being said, let's talk a little bit about birth control. I found this cute little timeline that was created by Planned Parenthood. It is 100 years of birth control from 1914 to quote-unquote today. This was actually came out in 2014. And I'm just going to skim through this a little bit. So it starts June 25th, 1914. Planned Parenthood's founder, Margaret Sanger, coins the term birth control and uses the phrase in an issue of The Woman Rebel. She's indicted for violations of the Comstock Law, which outlawed contraception and declared information about it obscene. In October 16th, 1916, she opens the first birth control clinic in Brooklyn, New York. 10 days later, she and others are arrested and the clinic is closed down. Then she spends 30 days in prison. As of 1916, 30 states still have Comstock laws which prohibit or restrict the sale and advertisement of birth control. Finally, June 23rd, 1916, the pill arrives. The Food and Drug Administration, also known as the FDA, approves the birth control pill as an oral contraceptive. June 7th, 1965, Griswold versus Connecticut is a thing. The U.S. Supreme Court rules that married couples have the right to contraception in a case triggered by Planned Parenthood's first clinic in New Haven, Connecticut. So we're going to skip down a little bit and talk about 1984. That year, the FDA approves the distribution of the copper T380A IUD, but for 4 years, no manufacturers or distributors are willing to make it available to women in the U.S. In 1998, Planned Parenthood wins a major legislative victory requiring prescription contraceptive drugs and devices be included in insurance coverage for all employees of the federal government. From 2012 to 2014. So in 2013, the FDA lifts the age restrictions for the over-the-counter sale of Plan B, which is great. Health insurance plans are now required to cover all FDA contraceptives with no copay. An estimated 30 million women nationally are benefiting from Obamacare's preventative health care provision. As of 2014, it says 99% of sexually active American women have used birth control at some point in their lives, or American people have used birth control at some point of their lives. And nearly 60% of Americans who use the birth control pill use it for health-related reasons like treating endometriosis, menstrual pain, menstrual regulation, etc. So obviously the pill is more than just, preventing having kids. Many people use it for many different reasons. And so even though I feel like we shouldn't have to bring that up to make it make sense for these legislators, birth control is a right, point blank, period. It is a right for every person. Everybody should be able to get this pill over the counter without having to jump through hoops, whether it's the lack of insurance or, having a difficult time getting a doctor to write a prescription, etc., etc. There's so many things that, people have to jump through depending on where you're at and things like that make it difficult to get birth control. And that's super dumb in my opinion. So, switching gears a little bit, we have a great interview with Access Esperanza's Jackie Joy Ho-Shing. She is a community health educator, and she is part of Access Esperanza, which is a clinic in the McAllen area. And I hope you guys get some great insight from Jackie and you enjoy this interview.
Yeah, so my name is Jackie Joy Ho-Shing. I'm a community health educator at Access Esperanza clinics in Hidalgo County in South Texas. I guess South Texas is like McAllen, because a lot of people think San Antonio is South Texas. So just to clarify, it's in the McAllen area.
Okay. So when it comes to Access Esperanza, what is your number one mission or goal when it comes to reproductive health?
So our goal or mission would be to provide affordable to free reproductive health care for folks in our community. So those who really need birth control, a pap smear, a physical exam. So we want to be able to give them the resources to get family planning.
And can you give us some kind of examples of some of the things that you guys do?
Yeah, so we besides our clinic, which we offer free to low cost, but most of the time it's free because we have different funding programs. We offer free birth control, so depending on what kind of birth control a person wants. So if they want the pills attached to the ring, if they are a good candidate for those, we'll give them that for the whole year. So they don't even have to go to a pharmacy, or they don't even have to come back to us every month, right, to get it. They can just we'll give it to them for the whole year. And then we also do pretty fast, like let's say you want an appointment tomorrow, right? And you're interested in the IUD, we can get, if you qualify, because not everyone's body is a good candidate for it, right? If you're a good candidate for the IUD, we'll insert it either that day or the next day. So that's it. That's the same thing with the implant and the shot. We'll give it to you right away. So we try to see our patients and where they're at in their life, and we know that not a lot of people have accessibility to come in to our clinic like 3 or 4 times to get their pap smear and then their birth control and then their STD test, because I know a lot of other doctors' offices sometimes they'd rather just do separate visits, but we know it's easier for our patients if they come in and then just get all of that in one visit. So that's one of the things I really love about our clinic is that we we try to be accommodating to the people who come in, and we understand that life is hard, so we want to make sure it is as easy as possible.
Mm-hmm.
And we also offer free to low cost diabetes and cholesterol testing and management. We just added that. And if you have a history of breast cancer in your family, we have a doctor who offers once a month a couple of free mammograms, and then she also looks over the scans for you. So that's an added bonus coming to us, is that we have that program. We also have a promotora program, so similar to what I do. I go into community and do presentations. Not right now with COVID, it's mostly online, but we have a couple of promotoras who are community health workers, and they go into the colonias and health fairs, and they're spread out throughout Hidalgo County, and they are now going door to door talking to women and folks who might need our services and encouraging them to come in because we're still open. And most of them are Spanish speaking folks, and then and Spanish is their first language, so they are part of the community, and they're not just people who come in and they're like, we want to go and talk to all the folks, you know. They are part of the community, and they understand what the community of, like, depending on, you know, where the community is, because each community is different. Even though Hidalgo County is one community, there's different communities within the community, if that makes sense. So they're able to go in and assist folks in making an appointment, seeing what their needs are, and helping them find resources if they need help with other things. So we do a lot in the area.
Yeah, it sounds like a lot, and I think that's such a great thing, to be making a lot of these things so accessible for everyone. So, have you heard about the Free the Pill campaign?
Yes. So I saw it through like Bedsider, and I think some other organizations have talked about it, making birth control pills completely free. Right? I think. Right? Am I wrong?
That's part of it. Yes. Also,
yeah, or like just birth control in general, but the term is just free the pill.
Yeah. That, and also trying to get it over the counter.
Yeah.
As well.
Just to make it more accessible for a lot of folks, because it can be hard to get birth control to come into the clinic, and then maybe you just don't want to talk to folks, and like you're just like anxious. So yeah, I've heard of free the pill.
So when it comes to birth control access, especially in lower income areas, is there any struggles that you can think of when trying to obtain oral contraceptives?
I think for the folks that are coming into our clinic, it would be coming into our clinic. You know, right now with COVID, it's a little difficult because a lot of people live at home with their families, and they're either taking care of their sisters and brothers and sisters, or it's a mother of kids, right? And their husband is working, and they can't necessarily leave their kids at home by themselves because they don't want their kids to be with someone else because it's not the safest thing, right?
Mm-hmm.
So transportation would be one. A lot of people have maybe one car, or they share that car with all the people in the family. And another one would be time, the availability to leave and go, because sometimes appointments take all day, because you know any doctor's office would take all day. Like we'll try to see you within like 3 hours, but there's no promises, right? And with COVID, we're asking folks to wait in the car instead of inside the clinic before coming in. So that can also be a barrier, because you don't want to leave your kids in the car when you go in for your appointment. Not knowing we are here, we're trying to up our social media, and we're doing a radio ad. So we're trying to figure out how to let people know that we're here. We've been a family planning clinic since like 50 something years, so we've been here for a long time, but a lot of people still don't know about us. So, and they don't believe that it's free if they qualify, right? So they're like, oh, I'm going to end up having to pay $20, right? And I can't afford it. But it is free if you qualify, and we can do your qualification within your appointment, so you don't have to worry about coming in to be qualified and then coming in the next day for your appointment, right? Like, it's going to be that appointment. So
can you tell me a little bit more about this qualification process?
we have different programs, and there's three big major programs. So if you are a woman, or if you have a vulva or a uterus, right, and you are a U.S. citizen, between the ages, I don't know what the age range is, but like 18 to 45, maybe. Wait, I have to double check the age ranges, but you would qualify for Healthy Texas Women, so that's a program run by the state of Texas, and you would just need to bring your passport if you have it, or your social security, and or birth certificate. So just a proof of citizenship and the last two pay stubs. And then there's an income barrier where we look at your income and say, okay, based on your income, you qualify. Changing right now, so I don't know the numbers off the top of my head, but most people qualify. And then the other programs, we have programs for people without documents and for men and teens. So the other two programs are Title 10 and Family Planning.
My next question is, especially since right now with the pandemic, we already talked a little bit about that, and how it's difficult for people to get access to come into the clinic and other things. Can you think of any negative effects that can impact those who are unable to have access to these contraceptives?
So, as in general, Texas has one of the highest rates of teen pregnancies in the U.S., and then the Valley has one of the highest rates of repeat teen pregnancies. So it's teens who've had a kid when they were 13 or 14 and then ended up having another kid when they were 16 or 17 or even 18, because 18-year-olds are still considered teens, right? So if they don't have access to birth control, it's really hard for them to plan their lives and reach their goals that they want to. So it really affects a family, because it affects not only a person, but whoever they're living with. And because we're such a communal culture where a lot of people live with their parents or with their grandparents, right? It doesn't just affect one person's dreams, it affects the dreams of the whole family. Like, that person was thinking, oh, I want to graduate college, but I can't really right now because I can't afford it, right?
Yeah.
So it really does affect not only the short-term goals of a person, but also their long-term goals.
Are there any myths surrounding birth control that you can dispel?
So if you get on birth control, you are not going to end up sterile. That's one of the number one questions I get from folks. It's like, oh, I heard if you take the pill for 30 years or 20 years or 10 years or even 5 years, you're not going to be able to ever have a child, which is a complete lie. Sometimes people who want to get pregnant end up on the pill because they want to regulate their period, and then they get off the pill because their period is regulated, which I know sounds really counterintuitive, but birth control can help with both helping someone to get pregnant and helping someone not to get pregnant. So, and there's a lot of benefits that people don't think about when it comes to birth control. Regulating your period, helping with your cramps, acne, giving you a sense of peace that I'm protecting myself from an unplanned pregnancy, and helping with my future, because things can happen, and at least I'm protecting myself. And another myth, which sounds really funny, is 2 condoms. I get this from teen boys all the time. Like, what about two condoms? No, just use one. And we also offer free condoms at our clinic, and we've given out boxes of condoms to different restaurants for curbside pickup when the pandemic started. So we're trying to help people get condoms if they need it and they can't come to the clinic. So.
What can we do as a community to make over-the-counter oral contraceptives more accessible for everyone?
Donate to your local family planning clinic that is low income, like us, and also check in on what legislation is about to go in and who's ever doing the budget for for these programs, because sometimes they want to slash programs. They were thinking of slashing it, and I think they decided not to for a healthy Texas woman. And Title 10 has also changed a lot the rules of like what can we do under Title 10. So keep updated with who's making the decisions of the budget, and if they're doing something silly like we're going to slash it by 60% because people aren't really using it. No, people are using it. You just don't want, people to use it, right? So contact your congressmen and senators and be like, we really need this money. And it'd be nice if we didn't have to worry so much and it was just a given. Birth control is free, no matter who you are. That would be like my dream, in 5 years, 10 years.
My final question is, so you are based in, like the Hidalgo area, McAllen. Can you just tell us every clinic you are and the best way for those who live in those areas, how they can contact you to schedule an appointment?
Yeah. So we have 4 clinics in McAllen, Edinburgh, Mission, and Westlake. And the easiest way to make an appointment is give us a call at 956-688-3700. I'm going to repeat the number in case people didn't catch it. 956-688-3700. And also they can check out our website, accessclinics.org. It's accessclinics with an S.org. And we have a form you can fill out to request an appointment. So you don't even have to talk to us, and then we'll call you and ask you when you want your appointment. Usually, if you call today, by Friday, you should be able to get an appointment at any of the clinics you want. We try to see people as soon as possible from when they call. I forgot to also mention that we offer Plan B. The first one's free for a lot of folks, and then the second one is $35, which is a lot cheaper than going to Walmart or Target.
Well, thank you so much, Jackie, for coming and doing this interview with me. I really do appreciate it.
Of course.
Thank you again so much, and
no problem.
Hope you have a great rest of your day.
You too. Bye.
Bye. Thank you guys so much for listening to this episode and this great interview. Thank you so much to Jackie for coming on the podcast. And guys, make sure you go and check out Free the Pill Fest. It's going to be on the Urge socials. I believe it's urge_TX. And also check out their website, urge.org. And I hope you guys are doing well and staying safe.